Sometimes it can be very challenging and complicated to decide when you reach the threshold where medication adjustments are needed. Because Parkinson's disease is a relentlessly progressive disorder, it is only the question of time when such adjustment will be necessary, and it's not the question of if. However, when that time comes is less obvious. That's because there are many confounding factors. There are day-to-day variations of the symptoms. There are other problems that can confound how you perceive your Parkinson's symptoms. You can have a bad night's sleep. You can have some other independent emotional distress. You could have other ailments, flu. There is a number of circumstances that can have an impact on how you perceive your disability from Parkinson's disease. It is the doctor's job to work with you to determine whether your perceived worsening of your symptoms or your perceived increased disability is actually due to the steady progression of your Parkinson's disease and not due to some other confounding factors. To keep this in mind, you have to look at long-standing and consistent patterns as opposed to your day-to-day functioning. It is very helpful to keep track of your daily functioning in diaries. There are several diaries that are currently in use to serve this function, and they are usually designed to allow you to indicate the timing of your medications every day, as well as tracking your symptoms hour by hour. The best diaries indicate the severity of your motor symptoms, whether you are on or off, sometimes allowing you to grade it with several different levels. They also allow you to mark if you had dyskinesias or no dyskinesias, and you can do that for every hour. This would allow your doctor to overview a longer period of time and decide if you have some consistent worsening of your motor functions and symptoms that would require adjustments of your medications. I would also like to address how you communicate with your doctor. It is very important that your doctor is informed about your perceived worsening of your symptoms, and if you think that your disability from your Parkinson's motor deficits increased. I mentioned earlier that there are diaries which allow you to document your motor functioning on an hourly basis over a longer period of time. I follow a large number of Parkinson's patients, and I encourage them to communicate with me by email, if that is possible, and report the outcome of these daily diaries and tracking of their motor functions that way. I usually see patients every 6 months, and I encourage them that in the preceding 2 to 3 weeks, they do the diaries on a daily basis. It allows the doctor to decide how medications need to be adjusted. Because of the fluctuating nature of some of the medication responses, it also allows the doctor to adjust your medications within the day according to when you have your symptoms worse, as opposed to when sometimes you have dyskinesias. The tracking of these symptoms daily and reporting to the doctor in a more or less regular manner will be extremely valuable in your doctor to develop the most optimal schedule for you. Sometimes it is not going to be perfect because the therapeutic window can be so narrow, but for the optimal regimen, it is important to have as accurate information about your daily motor functioning as possible.